It's a common heart problem that, if left untreated, can increase your risk of heart failure or stroke. Doctors at Boulder Community Health say atrial fibrillation, or AFib, is the most common irregularity in the heart's rhythm.
It's a very individual disease, and it can be experienced on a very kind of granular individual basis. So some common symptoms that people might report are a sense of palpitations, which is just a sensation that your heart rhythm isn't quite right, that something's erratic. People might feel that their heart is actually racing, which is one of the most common immediate effects of atrial fibrillation. Because of the loss of efficiency in cardiac function that happens with atrial fibrillation, sometimes people might report shortness of breath or swelling in the legs or difficulty breathing in certain body positions, especially when lying back in a recliner chair or in their bed.
The doctor we spoke with says AFib can be caused by a number of factors, including heart disease, along with other diseases like diabetes or hypertension, and lifestyle choices like stimulant drug use. It typically starts with brief, infrequent episodes, but as it becomes more frequent, patients should seek treatment.
Treatment options may include simply watching that patient. If we've identified the very first episode of AFib in somebody, we might just stand back and say, we're going to monitor you over the years and see. For all we know, it could be another 5 or 10 years before the next episode. We may institute medications to prevent further episodes of atrial fibrillation. We may offer procedures such as catheter ablation, which are meant to reduce the burden of AFib. We may even talk about open heart surgery to treat AFib in conjunction with one of the underlying structural heart conditions, which we might identify as the cause.
Patients may also need medications to reduce the risk of stroke. Boulder Community Health has a multidisciplinary team, including cardiologists and surgeons, to help determine the best options for AFib patients.